Hey everyone, Adam here from Social Good Families, Holly as well. We're here to bring you an expert interview with the aim of helping you, all of us, learn about and be more effective in the ways we engage in social good. Today's focus falls in the category of clean water and sanitation, which is number 6 of the 17 global goals established by the UN. If you're not familiar with them, you should look them up, globalgoals.org.
So to help us learn more about this topic, we are thrilled to be joined today by our expert, who is Nga Nguyen, who is the Senior Water, Sanitation, and Hygiene and Social Behavior Change Advisor at USAID's Office of Maternal and Child Health and Nutrition.
Longest title we've ever had on this show.
She brings over 15 years of field experience in social and behavior change, working on a variety of behaviors. For example, she led a large-scale hand-washing with soap promotion program for the World Bank in Vietnam. And she has supported governments all over Asia to design and implement social and behavior change initiatives in WASH and in maternal and child health. So Nga, thank you for being with us today. It's good to have you here.
Pleasure to be here. So beyond having the longest title ever on this website, my title is Senior Water, Sanitation, and Hygiene Specialist, but I'm also the Social and Behavior Change Advisor at USAID. So what does that mean? So just a bit about my background. I have spent the last 16 years, 17 years overseas, living in Southeast Asia, including Vietnam and Thailand. I've worked in a variety of countries, including Cambodia, Laos, Philippines, Indonesia, South Asia, Bhutan, Nepal, as well as in Central Asia and Kyrgyzstan. So most of my life overseas. I've only been back to the US for the last 4 months to start my new job. And in my job, what I basically do is I work with a whole team of people who are working on water, sanitation, and hygiene issues. My specialty is to help programs, to help my colleagues, to help the USAID offices design programs that work towards changing behaviors. I'm really looking at how we can get more households, communities to wash their hands with soap at the right time. A lot of communities where there's a lot of open defecation, where people don't have latrines, I'm working with them to figure out ways to market latrines the way that we would market a mobile phone, the way that we would market products that are aspirational, that people want. We found that in the past, just talking about the health benefits of latrines just simply doesn't sell. So we've got to make it sexy and affordable. And we have to make sure that people can buy the latrines once they're interested in the latrine. So it's not really just saying, convincing them that, hey, you want this product. Then you also have to help make sure there's a supply chain there. Like, you want to buy a toilet, where do they start? What do they need to buy? Where do they buy it from? Who do they call to help install it, etc.
Is there then follow-up that has to be done afterward? When you sell the product, you finally market it, you sell it, it's there, installed. Then is there follow-up?
There's tons of follow-up, because what happens is, depends on like the latrine that you build, right? So if you build like a pretty good model, deluxe model, it's all in, it's done, and you spend a lot of money on it, you're much more likely to upkeep it. But then some people who can't afford to have like the premium products will a very simple pit latrine. And as we know, like if you go to an outhouse in the US, it smells. After a while, it disintegrates, the pit fills up, it's disgusting. You can see the feces and the urine and all the products underneath. And this really then becomes a very undesirable product. So then what people have to do is then they actually revert back to defecating in the open. So there's, so after they build the latrine, the behavior then is how do they maintain it? How do they take care of it so that it stays clean? But then also, how do they empty out the tank when it's full? So for most of us that are connected to sewerage, we never think about it, we flush it, it's gone. But when I lived in Thailand, we had 2 septic tanks, and one of them always seemed to be not working. We had to find the septic tank guys, the guys would come with the pump trucks and like suck out our septic tank. And it was really a quite unpleasant experience, and actually often quite expensive. So so there's this whole, in the Sustainable Development Goals, previously, when we had the Millennium Development Goals, what we were worried about in sanitation and water is that people just get the latrines, right? And that they get it, and that we have what we call coverage, which is increasing rates of access to toilets. But now with SDGs, it's not just about getting the latrines, it's actually maintaining them, making sure that people will have services fecal sludge management, so fecal emptying services. So the whole thing, so that in the end, they're still maintaining their latrines, they don't just revert back to open defecation.
Yeah.
So
fascinating.
It doesn't end with the purchase and installation and use.
Is it generally the more expensive route, and so you have to convince them that it's worth the money?
It really depends on which communities and the context that you're working in. You have some communities that have lots of people with lots of toilets, right? And so and maybe the status of toilet is like unimproved or like not very nice. And what they need to do is they need to upgrade to a higher model, because really when you're doing like a basic latrine, what you're talking about is not really, is public health, right? So you just want to contain that feces in a simple pit latrine because you don't want to have feces in the environment and you don't want to get sick. But later on, what you have to think about, particularly in urban areas where you have a lot of people clustered together, you have to get them to improve, which means underneath the toilet has to be sealed, it has to be closed. And so, and at that point, you're thinking about protecting the environment, the water source. So it's public health and the environment. But what you start off with initially is sort of the public health aspect to it. So it really depends your product, like where you are on what we call the sanitation ladder. So at the very bottom, you're open defecation, and at the top of the ladder, you're like a hygienic, improved latrine. You know, one of the key drivers that I always find that people are like, okay, I want the latrine, is really privacy and convenience, right? Like if we think about how we use a latrine, I mean, do we really care if we have a toilet that's Kohler brand or Toto brand? No, it's like we go to a toilet because it's enclosed, we have privacy, we can, you know, nobody's bothering us, nobody sees what we're doing, it's comfortable, it's easy to access at night. We're not thinking necessarily of all, you know, all these different options. And so when we talk about latrines, particularly for people who don't own them, it's really about dignity. It's really about having privacy. It's really about having facilities that are convenient, that are safe for your family. So I have, you know, I've seen latrines that are like, you know, way out there in the ocean. I just was in Indonesia a couple weeks ago, and I can show you this picture where you have to walk out in these tiny little wooden planks out into the ocean, and then you have a latrine, but it actually just empties into the waste, into the ocean. But beyond the public health problem, can you imagine your 2-year-old or your elderly grandmother having to walk out there, particularly in the night, right? So you're not really going to use that latrine at night. Really talking about, okay, so how can you keep your family safe? How can you provide dignity for your wife, for your daughter, for your ailing mother? So those sort of very tangible, but also very emotional benefits really, I think, speak to people that don't have latrines. But then when you're talking about somebody who wants to upgrade, right? So it's like you already have something. So how can I convince you to go from a regular touch tone phone or whatever to an iPhone, right? It's a very different way of marketing the product. So there we talk a lot more about status. It's like, hey, you know, like Adam's got an iPhone. Why doesn't Holly have an iPhone? Why are you still doing the, what are they called? The digital, no, whatever they call. You know, those old phones that we used to have. I don't even know what they're called. The non-smartphones, right? So it's like, Holly, get smart. Adam's got a smartphone. Why don't you get smart? So a lot of things about like social norms and status might be drivers for getting a community to go from improved to a hygienic latrine.
Are there any specific anecdotes that you can tell us that will help us understand the, you know, why this issue is so important and the work that you're doing?
You've probably seen a lot.
Way too many dirty toilets. Well, I mean, if you just bring it back to where you're living now, like if one day you just woke up and you just didn't have that toilet in your house. You had everything else, but you didn't have that toilet. Just imagine how your life would change if you had to look around and find a secret place to do your, to do your thing, and for all your children to do that, or when you're sick with a stomachache and you just have no bathroom. So just imagine waking up the next day and just being like, there's nothing in that room. There's nothing. So it would dramatically alter your life, right? And out of the world's population, 1 billion people live without a latrine. So it's kind of like providing them with the most basic, like a really basic human need, right? Is to be able to wake up in the morning and do something that is completely natural, which is necessary, something biological. And people, particularly women, do not have a safe space to do that. I think you probably heard the stories in India where the women have gone out to find a place to defecate, and they've been raped. They've been harassed. It's very unsafe. Like if you have to go out late at night and then it's like you walk outside, it's completely dark, it's in the rainy season or whatever, and you don't even have the most basic fundamental, place to do something as necessary as that. I think is one of those basic human needs that people don't think about until the day you go and you realize you don't have access to it, right? It's like going camping, but not even camping, because in the US, when you're going camping, it's a pretty clean environment. It's like, imagine going to a place and having to defecate where all these other people defecate and seeing all this other feces and urine and fat and all that stuff. And that's what you're exposing yourself and your children to every single day when you have to do something.
And what are the health issues that come with a lack of infrastructure in this regard?
Well, I mean, the biggest thing that people track really is diarrhea. And that has traditionally been the indicator for good health. So now we're finding that actually it's much more complicated, and that we are finding that unsafe water or unsanitary conditions, environments also leads to stunting, which is when children are too short for their height. But when you're stunted, that is an indicator that you have suffered from like long-term malnutrition, and you don't necessarily make up that height. In addition, you also lose cognitive ability. I mean, you lose out. You're not as smart. You're not as developing as quickly as other people. So we're also finding that WASH is really not just about diarrhea, but WASH also contributes to a lot to the reason why you see that a lot of children are too short for their height across the world. And stunting is something that you cannot see. It's almost because everybody is short. It's just the norm, right? And so it's one of those things that's very hard to see with your eye, but then also we're finding that there's lots of things that are contributing to stunting, and resolving stunting is you can only actually reduce stunting by 20%, even if you give all the best package of nutritional interventions. Wow. So all your perfect nutritional interventions, all your the most perfect behaviors, the most perfect caloric intake, etc., for a stunted child can only reduce that stunting by 20% in a country. So we have to look beyond from nutrition, for example, and there's a lot of evidence to show that having a clean environment, including toilets and running water and soap, can really contribute to that.
Wow.
And what areas in Asia have gone and seen a kind of the worst case scenario where there really is there are no latrines, the health issues are very high, and maybe there's even a resistance to change?
I mean, if you look at the global statistics, most of those countries are going to be concentrated in Africa and then South Asia. So I've not traveled in Africa to work on water sanitation, so I can't say, but that is where you see the highest rates of child mortality, child stunting. You see low rates of latrine coverage, but South Asia also, I mean, India has a disproportionate number of households of the billion people that I was telling you about. I don't even want to quote the statistic, but of the billion people who don't have latrines, I would say probably over half of them are in India. So it contributes significantly. And so that's something that you might have heard if you ever heard of Modi, the Prime Minister of India. One of his big pushes is this Swachh Bharat campaign, which is to get 100% coverage, to get all households to have a latrine by 2019 or 2020, which is incredibly ambitious, but it's huge. So at least India recognizes there's a huge problem, but then countries like Pakistan you also have very high rate of open defecation. And in those countries, it's also, it's not even just the rate, it's the population density. When you think about the risks to health and the environment in the context of Bangladesh, was just incredibly densely populated versus a country like Laos, which only has 7 million people total. So the impact of open defecation is much more pronounced in Bangladesh than it is in Laos. So I will say, though, Bangladesh also is one of those success stories in that they've actually done a lot. And so Bangladesh can only be used as a reference for lots of people, but actually they actually have very high rates of basic sanitation, where almost the whole country has some kind of toilet. So in some of the countries that have made progress, what they're working now is just because you have high rates of households that have latrines, your job is to finish because they're not hygienic. So they're not sealed, like the tank is not sealed. So in a lot of the cases, the toilets are still in such bad shape that they're still polluting the environment. So what you want to move people towards is something that doesn't pollute the environment. So there's still work. They're just slightly different challenges.
Our governments they don't think it's a priority if they're considering, all of the social, environmental, and just political issues that are happening does it just end up at the bottom of the list? And so there's never
Yeah. Sanitation, selling. So in the sector, selling water is an easy sell. Water's sexy. Water is necessary. Everybody gets it. They just get water, right? But they don't always understand why latrines are important. And we've made a lot of inroads. I mean, a lot of the World Bank, USAID, DFID, that's the British government's arm of overseas development. Lots of the donors have put tons of money to make sanitation a priority. And that's why actually in the SDGs, you see so many indicators that address sanitation, because within the last 10, 15 years, we've increasingly looked at sanitation as a core issue. And then now also a big change in the Sustainable Development Goals is this emphasis on equity, and that we're not leaving anyone behind in the increase in looking at vulnerable populations. So we're looking at women and how they access facilities differently. Because even in a household, there was a recent very good qualitative study, and in the households with latrines, it's very interesting how women at different parts of their life cycle use the latrine. So, for example, if you have a daughter that's getting ready to be married, those girls actually have the most freedom because they're older, they're independent, and they still live with their parents. So they can freely access a latrine if their family has one. However, once that girl is married and she's recently married into a new family, and even if that new family has a latrine, she's got so many different competing priorities. She's got to do housework, she's got to help out her mother-in-law, she's got to do all these things that actually is the time where she actually doesn't have very much agency or self-efficacy or the ability to negotiate, even using a latrine. So there's studies showing in India that women will just have to hold. They'll just have to hold in until they can find a time. And when they go very quickly because they don't want to be accused of wasting time by just being lazy and using all this time to go to a latrine. So once they get a little bit older, they have more autonomy, and then of course the older women have the most autonomy. But it's very interesting to look at. So all we do in the sector pretty much is say, okay, so you have a latrine, let's focus on cleaning it, maintaining it. But now you have to really look at sort of the who is accessing, who can really use it, even if you have that. And so much of that is dependent on gender norms and social norms and status of women. So it's not to say that if you have a latrine means you can use it anytime you want.
You've given us a lot to think about. I honestly hadn't thought about so many of the angles that you brought up. But so we're like the average Joe Schmo family over here. And now our awareness has been heightened about this issue, but what on earth can we do about it? Like, what are some things that average people can do to help achieve this goal of clean water?
Right. Well, I mean, some of the things that you can just do every day is just realize that, some people across the world it takes them 40 minutes to go and get 2 gallons of water. So you can think about, when you use water every day, do you need to keep it running while you brush your teeth? No, not necessarily, because all that water that you're wasting then needs to be processed, and all the energy and effort that goes into treating that water so that you can reuse it again. So on a personal level, just thinking about, am I using this water wisely? valuing water. I think just really just appreciating your having a toilet, and supporting organizations that obviously do water and sanitation. Talking to other people about why it's important to have a latrine, and just giving them like a very basic, what if you woke up tomorrow, you had no toilet? What would you do? So, just thinking through how would your day be affected by that, and just having appreciation of it. I will say one of the challenges in this sector, I would say historically, has been that governments in the past have said, okay, listen, so if you don't have a toilet, I'll just give you one. And then it's over, it's solved. And so governments gave a lot of subsidies, they gave out a lot of toilets, and people became complacent because, at first they didn't really see the need for it, because in a lot of cultures, people prefer to defecate in the field. It's a much more pleasant experience than going to some nasty pit latrine that's falling apart with flies all over the place, right? Rather you just go sit in the field. So there's already in some countries cultural preferences for defecating in the open, and then the government comes and they're like, oh, we'll just give you a latrine. And so people then are like, well, then there's no need for me to actually buy my own latrine. I'm just going to wait for the government to do it. I'm just going to wait for a USAID project or a World Bank project to give it to me. And so now we really work on getting households to pay for their latrine. And if they can't pay for all of it, they need to pay for some of that. I remember one of the, my first sort of like aha moment in development was I was in Vietnam in 2001, and I was on the motorbike, in the back of my motorbike of my colleague, and he was driving around the community, and I was like, I asked him, I was like, oh, you know what, man, this community has really nice chicken coops. I mean, their chicken coops are outstanding, really nice walls and a really nice roof. The chickens are in there. And he's like, oh, actually, that's like the materials that we gave them to build their toilets. I'm like, really? So they never used them. So they just built the outside with the walls and the roof. There's nothing underneath, so it's not really a toilet. It was just used as a chicken coop. Really fancy one. And then there were other households that just left all the brick and all the cement in their yards, and they never used them. And basically the only thing the organization was requiring them to do was to use their own labor to put it together. But because we never done any kind of sort of awareness raising behavior change activities, people did not see the need for it. And they also, maybe didn't want to invest the extra money to actually make the toilet part. So there are still organizations that are increasingly less. There are organizations that still say, hey, why don't you just pay $2,000 and go on a field trip with us? A little bit like Habitat for Humanity, but although that's different. Let's just go build a toilet for our spring break. Wouldn't that be so great if we gave all these people their toilets? Their lives would be so much better. No, don't do that, because a lot of people, unless they work for the toilet, unless they pay for part of it, they don't value it and they're not going to use it. So in the end, you're just reinforcing what all the mistakes that the government has previously done, which just give them a toilet. So I'm not saying that in all cases that we don't need subsidies or to help the ultra poor families, but that there are plenty of families out there that can afford to build their own latrine. And the worst thing you can do is come in on a feel-good trip and build a latrine, give them all this free labor, give them all the materials, and then walk away with a picture of them standing in front of the latrine, because you're basically undermining what all the other efforts of international organizations are doing, which is to try to get people to appreciate and invest in their own sanitation facilities.
I think that is valid concerns that organizations like yours have done the research, they've been in the field, they've been on the ground, they know, the most effective ways to help with behavior change, right? So there's a lot to be said.
But I wouldn't say we know the most effective ways. We're trying. But I think, also to consider, like, if there are humanitarian organizations that are working with displaced populations, just to consider sort of contributing to those, particularly the ones that are going to, look at like the water and sanitation, the menstruation management stuff, that kind of stuff that people really need, but I think are just not really in the minds of like families. Like we just don't think about things like, oh, they might need pads when they get there, right? It's like they need food, they need clothing, they need shelter, they need water, yes. But then actually the women also have an added challenge in that they will get their menses at some point, and they will need assistance in getting access to some kind of product there. And so I know I just met with UNICEF at a conference last week, and they were talking about how they have bought all these different humanitarian packages, and it includes different things. And what's interesting is they don't actually give disposable pads, but they just give cloth. And so the cloth can be used as pads, but then other women decide if they don't use them, they can use them as wraps, use them like, as like hats, etc. But just, there are lots of organizations that have really thought about these things, and really so just looking at the organizations and seeing which ones are, I think, have the right mission and have thought about these things before you support them. And yeah, please don't volunteer to go overseas and build someone a latrine.
It seems your child has walked in.
Yeah, and that was my nanny. My male nanny, aka my husband.
It's a very familiar scenario.
Yes.
That's adorable. Okay, so what was so you just brought up one thing I had to say. I did one time purchase underwear from a company that also, when you bought their underwear, they sent pads overseas to,
the Tom Shoes model.
Yeah, Tom Shoes model, but for menstruation. So you're saying that's a good thing? What are you saying with those sorts of?
Yeah, it's hard to say. I mean, there's no black and white. We have to see, like, if they've analyzed the local situation and said, okay, these are the kinds of products that we're going to send to them, and this is what they need. That's perfectly fine. There is, there's complexities in all different kinds of products. For example, like if you start switching women to disposable products, like what we're used to in the West, and they don't know how to dispose them properly and they throw them down the toilets, they're going to clog all the septic tanks.
Of course.
And there's a lot, there's waste disposal issues that are also challenging. But, I just hope that organization, the company has looked into it and knows that what they're sending is what people would prefer to use, would likely use, and then hopefully they are able to clean it and or to dispose of it properly.
You do some research.
Yeah.
Before I buy it. All right. Well, thank you so much for being with us, Nga. We love all that you do and all the work that that you contribute to. Thanks for sharing with us. And if people want to get more information about what you do, is there a site they can go to?
There's a new movie out called Toilet. It's a full feature Bollywood movie about the guy getting married and the impact of his proposal because he doesn't have a toilet, something like that. So, I mean, those are things that actually are better than reading websites. So just rent the movie Toilet.
That's a really good challenge for families. Watch that movie. Simple.
Yeah, and that's a fun challenge.
And thanks everybody else for listening. You can learn more about what we do at socialgoodfamilies.com or on Instagram or on Facebook at Social Good Fams. And stay tuned for our next expert interview. Thanks again.
Okay, bye.